Good evening. My name is Kevin Serra, and today I'll be going over proprioceptive neuromuscular facilitation as a therapeutic exercise that can be used on patients of all ages. So, the purpose of this presentation is to educate the audience on the benefits of PNF and to persuade listeners to abandon their traditional methods of stretching and instead adopt PNF to achieve better results. So, what is proprioceptive neuromuscular facilitation? All PNF is a way to trick the body through its own mechanisms into relaxing the target muscle you're trying to relax. So, neuromuscular facilitation (PNF) was developed by Dr. Herman Kabat and Maggie Knott, and basically the treatment aims to restore function using specific sensory stimulation techniques on a joint. So imagine this: you have a patient um, on your table, laying on the supine position, and they're complaining about tight hamstrings. In order to treat this patient with PNF, you would stretch their hamstring to the point where they can no longer get any extra range of motion. So once you've gotten your full range of motion, you rest their leg on their shoulder, and then you ask the patient to create an isometric contraction. And by doing so, they are contracting. This is known as the contract relax method. So they contract through an isometric contraction, meaning there's no change in length in the muscle fibers, and then they relax. So this part is known as the contract relax method. And you would do this 2 to 3 times, and then have the patient take deep breaths. And then on the exhale, you'd want to gain extra range of motion by creating more tension and stretching that target muscle. So that's one type of PNF. The second type is known as contract relax antagonist contract, otherwise known as crack. So the difference between crack is the antagonist and contract portion. So basically, you're going to have that patient that's supine position, get into that maximum range of motion to where they no longer can stretch, and then you're going to have them contract, relax, and then as for the antagonist, you're going to want them to isometrically contract the antagonist muscle. So the antagonist muscle of the hamstring would be the quadriceps. So you'd ask the patient to contract their quadriceps. Once they contract their quadriceps, that's the contract portion. Then from there, you want them to take a deep breath, relax, and then on that exhale, you're going to slowly push and gain more range of motion. So for the crack method, you would do this about 1 to 2 times all the way through. And then you should notice that your patient has extra range of motion. So the reason this all happens is due to different methods and theories. These are known as autogenic inhibition. And so basically, with autogenic inhibition, it relies on the body's own self-regulatory mechanisms relating to the GTOs, the Golgi tendon organs. And the Golgi tendon organs are proprioceptors, so they're muscle nerve receptors that play a role in the flexibility of that muscle. And so when the GTO is stimulated during a stretch, it causes that muscle to relax to prevent any overstretching or further injury, or like the muscle ripping apart. So the Golgi tendon organ is there to keep the muscle safe. So by slightly overstretching the muscle and causing that contraction, you're creating the Golgi tendon organ to forcefully relax the muscle. And so with autogenic inhibition, basically what's happening is the stretching of the contraction of the target muscle is going to allow for relaxation due to the GTOs. And so the muscle spindles are basically what's causing that contraction. So you could look at muscle spindles as being the opposite of GTOs. So muscle spindles contract and then GTOs relax. And so reciprocal inhibition, that's going to play a part in the crack method. So in the antagonist contract portion, reciprocal inhibition is simply stating that when you contract the antagonist muscle, you allow the target muscle to relax. So in the case of stretching the hamstrings, if I ask the patient to isometrically contract their quadriceps through reciprocal inhibition, the hamstrings will relax. So evidence. Active range of motion and passive range of motion for rehabilitating injuries has been shown to increase range of motion due to neuromuscular efficiency. Basically, when you're taking and stretching that muscle, you're allowing for greater range of motion because the muscle is able to relax due to autogenic inhibition and reciprocal inhibition. So it's good for rehabilitating injuries where you have diminished range of motion. So it's a way to gain range of motion. And so gaining range of motion. So McCarthy L. al. 1997 has shown that stretching has been long viewed as beneficial to enhance performance and decrease risk of injury during exercise, as well as improve range of motion and function following an injury. So as you can see, PNF can increase muscular performance and can be used to decrease the risk of injury. As for the gait control theory, the evidence argues that when the muscle is stretched forcefully past its natural range of motion, the GTOs are activated not only to relax the muscle, but also causes the muscle to send signals to the brain to cancel out nociceptors. So nociceptors are those pain receptors. So basically, the GTOs are alleviating pain through the gait control theory. And then as far as the results from Joshi and Aker 2015, they did a study in which they compared pre and post static stretch on hamstring flexibility, and they found that there was a high statistical significant difference in the hamstrings flexibility following a single session of static stretch through PNF. So let's move on. So reasoning. Okay, so there's overall benefits to enhancing performance and decreasing injury, and that is just beneficial to anyone from all walks of life, from teenagers playing sports to adults to geriatric patients. Everyone can benefit from more range of motion because the more flexible a joint is and a muscle is, the stronger it is. We like to think of when our muscles are tight to being stronger, but that's quite the opposite. So another thing I want to get into is PNF's strengths and its weaknesses. So its strength in pre-exercise is not that great, but it has been shown to improve performance in sub-maximal exercises. So these are exercises such as light jogging, light swimming, but it's not very well suited for maximal performances such as plyometrics or sprints or any high impact sports. But its main its main goal isn't to improve those maximal performances. Its main goal is to improve and maintain range of motion and flexibility in that joint capsule and that those muscle fibers. So one thing is that it is beneficial to strength, power, and performance after exercise because, like as we know, when we exercise a muscle, it becomes contracted, and if we leave a muscle in a contracted state, it becomes tight and weak. So, being able to activate the GTOs, autogenic inhibition, and use reciprocal inhibition can cause those uh, muscle fibers to relax and send signals to the brain through the gate control theory to reduce pain. So, conclusion, PNF should be done after exercise. PNF improvements on range of motion and flexibility are beneficial to anyone playing sports or to decrease injury. PNF can improve pain through the gate control theory, and PNF, like I said, is best used after exercise. Unless you're doing submaximal exercises, it is quite beneficial. So my references were from Hindle K. Whitcomb, T. Briggs, W. Ampong on proprioceptive neuromuscular facilitation, and Joshi M. Aker on the comparative effectiveness of static stretch and proprioceptive neuromuscular facilitation.